Do not underestimate it. Insomnia in the elderly can be hazardous. As individuals age, it is common for many older adults to experience greater challenges in attaining deep, uninterrupted sleep, which can result in persistent daily fatigue. Quality sleep serves as a crucial foundation for the overall health of older adults. Extended periods of sleep deprivation greatly diminish the quality of daily life. Reputable medical research has demonstrated that extended sleep deprivation in older adults considerably heightens the risk of severe cardiovascular disease, cognitive deterioration, and depression. Quality sleep is crucial for safeguarding brain function, improving cardiovascular health, and supporting a robust immune system in older adults. As we grow older, the body experiences numerous significant physiological changes that disturb the natural circadian rhythm, leading to a notable decrease in both the amount and quality of sleep. Recent medical studies indicate that more than 50% of individuals aged 60 and above in the United States experience chronic sleep disorders, significantly affecting their overall health and daily well-being. What causes insomnia in the elderly? Challenges with initiating sleep. Struggling to fall asleep for over 30 minutes while in bed can lead to stress and anxiety, ultimately diminishing the quality of life. Awaken during the night. Waking up several times throughout the night, with each instance requiring 20-30 minutes or more to return to sleep, results in disrupted and unproductive rest. Waking up early is often seen as undesirable. Waking up at least 30 minutes prior to the planned time and finding it impossible to return to sleep, despite the body still feeling fatigued and lacking energy for the day ahead. Common types of insomnia. Acute sleeplessness lasts from several days to under 3 months. Frequently occurs following events that induce psychological stress, mental trauma, or abrupt changes in living conditions and routines. If not addressed swiftly, it may develop into chronic insomnia. Persistent insomnia persists for over 3 months, happening at least 3 nights each week. Results in significant impairment of concentration, memory, and immune function, while also elevating the risk of cardiovascular disease, diabetes, and mental health disorders such as depression and anxiety. Illness-related insomnia. Due to underlying health issues like cardiovascular disease, chronic pain, sleep-disordered breathing, or psychiatric disorders, a comprehensive treatment approach is necessary. This approach should integrate management of the underlying conditions with strategies aimed at improving sleep quality. Factors contributing to insomnia in older adults. Physiological factors. Melatonin insufficiency. As we grow older, our bodies generate reduced amounts of the hormone melatonin, which governs our natural sleep-wake cycle. This decrease hinders our capacity to both fall asleep and maintain sleep during the night. Alterations in circadian rhythm. The internal biological clock undergoes considerable changes as one ages, resulting in older individuals frequently feeling drowsy earlier in the evening, approximately 8-9 p.m., and waking up naturally during the early morning hours, which contributes to a disrupted sleep-wake cycle. Hormonal dysregulation. Declines and fluctuations in the levels of key hormones, including cortisol, estrogen, and testosterone, as one ages disrupts sleep regulation. This disruption makes it challenging to attain deep sleep and increases the likelihood of waking up throughout the night. Pathological factors. Cardiovascular disorders. Heart conditions, including heart failure and arrhythmias, frequently lead to shortness of breath, chest pain during the night, disturbances in sleep, and result in frequent awakenings. Respiratory illness. Sleep apnea interrupts the flow of oxygen to the brain, whereas asthma and chronic obstructive pulmonary disease hinder the ability to achieve deep sleep and frequently lead individuals to awaken several times throughout the night. Persistent pain. Arthritis, sciatica, and chronic back pain not only complicate the search for a comfortable sleeping position, but also elevate stress levels, resulting in prolonged sleep disturbances. Psychological factors. Tension and worry. Persistent concerns regarding deteriorating health, financial uncertainty, or familial disputes maintain the elderly's minds in a continual state of stress, hindering their ability to relax and achieve restful sleep, resulting in chronic insomnia. Depression. This condition is prevalent among older adults but is frequently overlooked or misinterpreted as typical aging symptoms. Depression significantly disturbs the natural circadian rhythm and interferes with the sleep-wake cycle, resulting in fragmented and ineffective sleep. Isolation and grief. The passing of a loved one or extended periods of loneliness can lead to a profound sense of emptiness, resulting in older adults frequently experiencing challenges in falling asleep at first and waking up during the night feeling unsettled, unable to resume sleep. Environmental influence on sleep. Illumination and sound. The nervous system in older adults tends to be more reactive to environmental stimuli. Even minor disturbances, such as the flickering light from a street lamp or a subtle sound like the ticking of a clock, can disrupt deep sleep, greatly diminishing sleep quality. Unsuitable temperature. A bedroom that is excessively hot or cold can greatly diminish the quality of sleep for older adults. Comprehensive research indicates that the optimal temperature for achieving restful sleep is between 18 to 20 degrees Celsius, which aids the body in preserving its natural circadian rhythm and facilitates a smooth transition into deep sleep. Unsupportive mattress and cushions. Insufficient support on the sleeping surface can lead to musculoskeletal discomfort, particularly in the back and neck of older adults. To reduce pain and enable the body to completely relax, it is advisable to use a mattress with a moderate firmness level and a pillow that accommodates your usual sleeping position. Impact of medications on sleep in older adults. Beta blockers for blood pressure management frequently leads to significant sleep disruptions, such as chronic insomnia and recurring nightmares, diminishing overall sleep quality. Selective serotonin reuptake inhibitors, SSRIs, causes sleep disruption characterized by excessive daytime drowsiness, nighttime insomnia, and interference with natural sleep cycles. Caffeine-infused pain relievers intensely activates the central nervous system, extends sleep duration, and considerably diminishes the quality of deep REM sleep. Influence of lifestyle. Insufficient physical activity. Inadequate physical activity throughout the day diminishes the body's capacity to expend energy, hindering its ability to achieve the physiological state of fatigue required in the evening. This results in surplus energy, complicating the process of entering deep sleep. Unconventional eating. Having dinner too late or consuming a heavy meal can cause the digestive system to exert more effort during rest periods, leading to sensations of fullness in the stomach, indigestion, and acid reflux. Foods that are spicy, sugary, and particularly caffeinated beverages can interfere with the body's natural circadian rhythm, ultimately diminishing sleep quality. Utilization of electronic devices. The blue light emitted by phones, tablets, and laptops directly disrupts the production of melatonin, a crucial hormone that governs the sleep-wake cycle. Furthermore, the engaging content from these devices heightens brain activity, hindering the mind's ability to achieve the relaxation state it is essential for restorative sleep. Immediate effects of sleep deprivation. Intense exhaustion and sluggishness. A sensation of profound fatigue that persists despite rest, causing the body to feel as though it is bearing an unseen weight. Older adults frequently experience dizziness, lightheadedness, and persistent sleepiness throughout the day, which greatly diminishes the quality of their daily lives. Immediate effects of sleep deprivation. Cognitive dysfunction. The capacity to focus and assimilate information is significantly diminished, resulting in challenges when making even basic decisions. Short-term memory becomes unstable, causing individuals to forget the names of cherished individuals, well-known locations, and crucial details in everyday life. Emotional fluctuations. Mood swings can be unpredictable and challenging to manage, fluctuating from profound sadness to abrupt irritability within a brief time frame. The ability to tolerate stress is considerably diminished, leading older individuals to respond excessively to situations that are typically considered normal, which adversely impacts family and social relationships. Long-term effects of sleep deprivation. Heightened risk of falls. Chronic sleep deprivation significantly disrupts balance and reaction time, increasing the risk of falls in older adults by threefold. The repercussions frequently involve hip fractures, head injuries, and potentially life-threatening complications. Immunodeficiency. Inadequate sleep greatly hinders the body's capacity to generate T lymphocytes and antibodies, increasing susceptibility to respiratory infections by 2 to 3 times. Individuals experiencing chronic insomnia frequently endure illnesses that persist 40% longer than those who obtain sufficient sleep. Progression of chronic illness. Clinical studies indicate that chronic sleep deprivation elevates the risk of cardiovascular disease by 48%, the probability of developing type 2 diabetes by 56%, and the risk of dementia by 37%. Each night of inadequate sleep shortens the average lifespan by approximately 20 minutes, accumulating over time. Connection to heart disease. Hypertension. Extended insomnia interferes with the blood pressure regulation system, resulting in the continuous constriction of blood vessels and an increase in peripheral resistance, which contributes to chronic hypertension that is challenging to manage with standard medications. Stroke risk. Chronic sleep deprivation triggers persistent inflammatory factors, encourages atherosclerosis, and enhances platelet adhesion, raising the risk of stroke by 4 to 6 times in comparison to individuals who obtain sufficient sleep. Arrhythmia. Individuals experiencing insomnia frequently exhibit a disrupted autonomic nervous system, resulting in an imbalance between sympathetic and parasympathetic functions. This imbalance can lead to serious cardiac rhythm disturbances, including atrial fibrillation, ventricular tachycardia, and sinus bradycardia. Effects on mental health. Depression is in 80%. Older adults experiencing chronic insomnia are 4 times more likely to develop depression, exhibiting symptoms such as a loss of interest, reduced energy, and feelings of hopelessness. Anxiety, 60%. Chronic sleep deprivation raises the risk of developing an anxiety disorder by 60%, hindering the ability to manage daily stressors effectively. Dementia, 35%. Long-term research indicates that individuals suffering from chronic insomnia face a 35% increased risk of developing dementia, particularly Alzheimer's disease. The effects of sleep deprivation on life quality. Self-care abilities, 35%. Reduced capacity to carry out fundamental daily tasks such as bathing, dressing, and meal preparation. Sleep disorders and diabetes. Blood glucose disorders. Extended periods of sleep deprivation greatly hinder glucose absorption and led to considerable insulin resistance, disrupting the body's sugar metabolism. Elevated risk of diabetes. Clinical studies indicate that individuals who frequently experience insomnia are twice as likely to develop type 2 diabetes compared to those who obtain sufficient sleep over a span of 5 to 10 years. Difficult to manage. Diabetic individuals experiencing insomnia frequently encounter severe and erratic blood sugar variations, which greatly diminish the efficacy of treatments and medications aimed at managing the condition. Complications. Chronic insomnia not only hastens the deterioration of blood vessels and nerves, but also leads to the earlier and more severe onset of dangerous complications associated with diabetes, sleep disorders, and overweight. Endocrine disorders. Insufficient sleep leads to a significant disruption in the hormones responsible for regulating hunger and fullness. In particular, the level of the hormone ghrelin, which stimulates appetite, rises by 15%, whereas the hormone leptin, which induces a sense of satiety, declines by 20%. This imbalance results in persistent hunger that can be challenging to manage. Sleep disorders and overweight. Irresistible urges. Individuals experiencing insomnia frequently desire foods high in sugar and saturated fats. This response is a survival mechanism of the brain, seeking a rapid source of energy to counteract the fatigue and weariness resulting from insufficient sleep. Reduced physical activity. Chronic fatigue can decrease daily physical activity by as much as 30%. Consequently, the body expends considerably fewer calories while consuming more energy than required, resulting in fat accumulation and uncontrolled weight gain over time. Indicators that you should consult a doctor. Persistent insomnia. Difficulty in initiating sleep or experiencing frequent awakenings throughout the night for a duration exceeding 3 months, with no noticeable improvement despite the implementation of proper sleep hygiene practices and lifestyle modifications. Influence on existence. Excessive daytime sleepiness most leads to cognitive decline, diminishes memory, impacts daily life quality, and heightens the risk of accidents while engaging in traffic or operating hazardous equipment. Questionable symptoms. Loud snoring paired with abrupt episodes of halted breathing, which may indicate sleep apnea. Awakening with a sensation of choking, morning headaches, or restless leg syndrome, RLS, that disrupts sleep. Non-pharmacological treatment. Cognitive behavioral therapy, a successful psychological method for recognizing and altering negative thoughts and beliefs regarding sleep, thus disrupting the cycle of chronic insomnia and fostering healthy sleep practices. Methods for relaxation, exercises like intentional deep breathing, progressive muscle relaxation, and positive visualization assist in soothing the nervous system, reducing the heart rate, and priming the mind and body for restorative sleep. Mindfulness and asanas. Consistent engagement in gentle meditation and yoga promotes equilibrium in the autonomic nervous system, leading to a notable decrease in the stress hormone cortisol and an increase in natural melatonin production, which contributes to deeper and more uninterrupted sleep. Sleep hygiene. Consistent sleep routine. Establish and consistently follow a set bedtime and wake-up time each day, including weekends and holidays. This regularity aids in optimizing your natural circadian rhythm, enhancing sleep quality, and increasing daytime energy. Cozy sleeping atmosphere. Transform your bedroom into a perfect sanctuary by incorporating gentle lighting, efficient soundproofing, a comfortable temperature range of 20-22 degrees C, and an ergonomic mattress and pillow combination that aligns with the natural contours of your body. A well-designed sleeping environment can decrease the time required to fall asleep by 30%. Reduce stimulants. Refrain from consuming caffeine for at least 6 hours prior to bedtime and avoid alcohol 4 hours before sleeping. These stimulants interfere with the REM sleep cycle, greatly diminishing the quality of deep sleep and resulting in feelings of fatigue even after a sufficient amount of sleep. The significance of light, natural sunlight. Ensure you receive a minimum of 30 minutes of sunlight each day, particularly during the early morning hours. Natural light plays a crucial role in effectively regulating your circadian rhythm, stimulates the production of vital vitamin D in the body, and enhances your mood and positive energy throughout the day. Minimize blue light exposure during nighttime. Minimize the use of electronic devices, including phones, tablets, and TVs for 1-2 hours prior to bedtime. If usage is necessary, enable nightlight mode or wear specialized blue light filtering glasses to mitigate adverse effects on melatonin production and sleep quality. Appropriate nighttime illumination. Select a nightlight that emits a warm color such as yellow, soft red, or orange, and has low intensity for use in the bedroom. This kind of light exerts minimal influence on melatonin production, which is a crucial hormone that governs the body's natural sleep cycle, facilitating easier and more restful sleep. The importance of exercise for sleep. Engage in regular physical activity. Engaging in 20-30 minutes of light physical activity each day enhances health and notably boosts sleep quality. It is advisable to steer clear of high-intensity workouts in the evening, as they may activate the nervous system and lead to sleep disturbances. Ideal training duration. Engaging in exercise during the early morning or early afternoon can help you utilize your body's natural energy. Studies indicate that vigorous exercise should be avoided within 3-4 hours of bedtime to enable cortisol levels to drop, thereby fostering optimal conditions for deep sleep. Efficient relaxation techniques. Focus on gentle activities like a 30-minute walk, calming yoga with poses that promote sleep, or Tai Chi to help balance energy. These exercises not only alleviate mental stress, but also encourage the production of endorphins, natural hormones associated with happiness, while safeguarding the skeletal system. Diet to enhance sleep quality. Foods high in tryptophan. Turkey, warm milk, pumpkin seeds, and sunflower seeds are excellent sources of tryptophan, an amino acid vital for quality sleep. Once ingested, tryptophan is transformed into serotonin and subsequently into melatonin, a hormone that governs your natural circadian rhythm. Chamomile herbal infusion. Chamomile tea possesses anti-anxiety properties and includes apigenin, an antioxidant that attaches to brain receptors that encourage sleep. It is advisable to savor a warm cup of unsweetened herbal tea approximately 60 minutes prior to bedtime. Peppermint herbal tea. Peppermint tea, with its gentle fragrance, aids in muscle relaxation and effectively alleviates stress. The natural scent of peppermint possesses a subtle sedative effect, assisting the elderly in achieving a more restful sleep. Tart cherries. Tart cherries and their juice are rich in natural melatonin, a hormone that helps regulate sleep cycles. Studies indicate that consuming a glass of tart cherry juice prior to bedtime can enhance the duration it takes to fall asleep and improve overall sleep quality. Relaxation methods. Prior to sleep, inhale deeply. Inhale deeply through your nose for a count of 4. Hold your breath softly for a count of 7, and then exhale gently through your mouth for a count of 8. Repeat this process 5 to 10 times. This method not only decreases blood pressure and alleviates stress, but also stimulates the parasympathetic nervous system, establishing optimal conditions for the body to enter a state of relaxation. Muscle relaxation techniques. Consciously tense each muscle group for 5 seconds, then fully relax for 10 seconds. Progress slowly from your feet to your neck and face. Focus on the warm, soothing sensation as you relax, which will aid in releasing tension points and alleviating stress accumulated throughout the day. Gentle, chill melodies. Select instrumental music featuring a slow tempo of 60-80 beats per minute, which corresponds to your resting heart rate. Utilize comfortable headphones and establish a timer to switch off after 30-45 minutes. Natural sounds like soft rain, ocean waves, or a babbling brook also foster the perfect acoustic setting, assisting your mind in gently transitioning to sleep. Modify your sleep environment. Ambient temperature. Maintaining an ideal temperature of 18 to 20 degrees establishes optimal conditions for deep sleep in RRM. Studies indicate that the body naturally cools down as it prepares for sleep. Thus, a cooler environment will facilitate this process and enhance sleep quality. Appropriate humidity. Maintaining a humidity level between 40 to 60% not only helps to prevent dry skin and breathing difficulties, but also lowers the risk of respiratory infections and allergies. Utilize a humidifier during the dry months, and if you lack a dedicated device, keep a glass of water beside your bed. Bedding and cushions. Select a mattress that offers moderate firmness, providing optimal support for the natural curvature of the spine. A pillow that aligns with your sleeping position, whether on your back, side, or stomach, will aid in fully relaxing the neck, shoulders, and back, thereby preventing discomfort upon waking. Noise management. Reduce distracting sounds by using earplugs, a white noise machine, or a mobile application. Studies indicate that the brain continues to process sound while sleeping. Therefore, a tranquil environment or steady noise can enhance your brain's ability to rest. Stress and anxiety out control. Optimistic mindset. Cultivate a habit of positive thinking and engage in gratitude for 10 minutes prior to bedtime. This practice allows the mind to relax profoundly and greatly enhances the quality of sleep. Problem resolution. Dedicate 5 minutes each evening to document specific concerns in a journal, along with 2-3 potential solutions for each issue. This method decreases mental stress by 40% and helps prevent negative thoughts from escalating. Social interaction. Actively cultivate and sustain a minimum of 3 to 5 meaningful relationships with family and friends. This consistent interaction fosters a sense of psychological safety, lowers cortisol levels, and enhances natural sleep patterns. Medication therapy, prescription sleep medications, reduces the duration required to fall asleep and enhances the capacity to sustain deep sleep during the night. Note, should be utilized only for a brief duration, 2 to 4 weeks, as there is a potential risk of dependence, daytime drowsiness, and other side effects. Melatonin supplements facilitates the regulation of internal biological rhythms, assisting the body in identifying natural sleep periods. Note, it is advisable to use low doses, 0.5 to 5 ml, administered 1-2 hours prior to bedtime, has minimal side effects and is appropriate for long-term use. Antidepressants enhances sleep architecture, boosts deep sleep phases, and alleviates anxiety symptoms. Note, it requires time to fully manifest its effects, 2 to 4 weeks, should not be discontinued suddenly, and must be closely supervised by a physician. Complementary therapies. Acupuncture. This traditional Chinese medicine technique activates specific acupuncture points on the body using fine needles. Numerous clinical studies have shown considerable effectiveness in enhancing sleep quality, decreasing the time required to fall asleep, and alleviating chronic insomnia in older adults. Phototherapy, a technique that employs high-intensity artificial light to influence natural circadian rhythms. Morning exposure to bright light aids in resetting the internal biological clock, enhancing natural melatonin production in the evening, particularly beneficial for the elderly during winter or in regions with limited natural light. Aromatherapy. Aromatherapy employs essential oils derived from plants like lavender, neroli, or jasmine. The delightful fragrances activate the nervous system, helping to alleviate stress and anxiety. It can be utilized through an essential oil diffuser, massage oil, aromatic bath water, or scented pillows to establish the perfect calming atmosphere prior to sleep. Techniques for managing insomnia. Engage in calming activities. Select calming activities like reading in gentle lighting, enjoying instrumental music, or engaging in deep breathing exercises. Steer clear of electronic devices that emit blue light as they inhibit melatonin production. Avoid checking the time. Cover or place your clock face down when you go to bed. Each time you glance at the clock upon waking, it can induce anxiety regarding insufficient sleep, establishing a detrimental cycle that heightens your alertness. Return to bed only when you feel sleepy. Wait until your eyelids become heavy and you genuinely feel drowsy before returning to bed. This method strengthens the positive connection between your sleep setting and your inherent sensations of sleepiness. Quality sleep serves as a fundamental basis for overall health, significantly influencing the preservation of cognitive function and cardiovascular health in older adults. Insomnia in older adults is not merely a sleep issue, it also serves as an indicator of various potential risks to both physical and mental health. Early detection, identifying specific causes, and implementing suitable solutions will enhance sleep quality, consequently improving the quality of life for the elderly. Now more than ever, sleep must be recognized as a vital component of holistic health care for the elderly, as a restful night's sleep serves as the cornerstone of a healthy and tranquil life. We have just explored the topic of insomnia in the elderly, a seemingly minor issue that significantly affects health and quality of life. Remember to like, share, and subscribe to the channel to stay updated on valuable health videos. Thank you for watching, and we look forward to seeing you in the next videos.